medical field a little bit more. So, but still, whatever I have learned in the last few months, whatever I know about it, so I have to share with you because there is another area of research where it requires a lot of inputs that our country may aim for bigger shares in the world market. So I recently also I had a small discussion or a conference with our Honorable Ministry of Textiles, Madam Smriti Irani, where we have presented our citrus Meditech products and things like that to her. What industries can take up from us, what is that facilities that are available with us, how we can help meditech industry, medical textile industries to grow up in India, what are the things which we can give from Citra for that. So those area which I have covered during that talk with Smriti Irani, I am putting it through here also, so that you will also be knowing what government can do, what private can do, what a public can do, what is that medical textiles is all about. So I can just introduce them to all of you, so that whatever I have learned in the last few months, so that I can also put it through. Though technically I was not very knowledgeable on the textile part, but after coming over here, this is a very vast field where whatever I know currently is only a point, not 1%. So that I am going to share it with you. Okay, I'll start my presentation. Are you able to see that?
Yes, sir.
Yeah, I'll put it through. Yeah, actually. Okay.
Yes, sir, you can proceed.
Yeah, okay. This is the scopes and opportunities in medical textiles. In medical textiles, actually, if you know, after COVID came into the picture, people understood that the medical textiles is all of surgical gowns and masks. But there are hell a lot of other materials which are very very important for the actually medical field, as well as common field which public can utilize it. South India Textile Research Association, as you are aware, it is about it's more than about 65-year-old organization. When it was started, and they put together and started this six. It was Citra. Cause of doing research in conventional textiles for helping the mills around Coimbatore to get their samples tested, their new products to get a prototype of the product, doing pilot scale studies and instruments to purchase for small manufacturing capacities and standards, generating standards. So many things the organization is currently been doing it. And I will explain about this a little later. For the time being, I would like to introduce you to medical textiles. Actually, if you take the case of COVID, actually, as of now, is around 11 crore people have been confirmed as COVID positive so far in this world, and around nearly closer to 25 lakh people have been died due to COVID. And America being the most problematic country, which had got more than approximately about 5 crore people, followed by Europe and Southeast Asia, as well as our India stands in around 1 crore people have been infected on that. So this is on the right side is the COVID virus, COVID-19 causing virus. This is called a corona SARS-CoV-2, and the electron micrograph is also given in this slide. So this is the typical crown-shaped material, which is surrounded by the spike protein, the cordus, and surrounded by this one, which is going to give the joined with our human immune cells and form the disease called COVID-19. Okay, what does COVID-19 influence? Why it influences the world economy in three different ways, because it creates a lot of problems and it produces disturbances in the market and network disturbances, and there are also heavily the business community as well as several private and public enterprises have been monetarily very much affected, because the manpowers, they were not able to get the proper manpower for that particular work to be done. Even after now, so many months have gone and so much opening has come out, but still they are still come to terms now. So this is how, and we also feel that it affects the global economy as well. It will also not only in Indian economy, it is also in global economy, because it creates all sorts of depression in supply chain, market depression, and production and demand also decreased. And this also sees that the prices of commodities which has gone increased in the market. So it creates a lot of problems. Medical textiles, as you are aware, I don't know a little bit. You will maybe aware, but I am going to put it through in four or five different segments. The first two segments is called as healthcare and hygiene segment, and this is called non-implantable segment, implantable segment, extracorporeal segments. These are all five different segments. It is used in the medical textiles. That is, most of us know about health and care and hygiene, because most of the gowns, surgical gowns, masks, bed linens, which has been used in the hospitals and in operation theaters, we will know that there are some healthcare and hygiene products are there. It is actually the healthcare and hygiene which we call it as for the patients and by the users, because it is directly connected to the public. That's why people know that this kind of textile or materials are available with that. But there are some other portions like non-implantable. We call this also, people may come to. Non-implantable is nothing but you have the band-aid like bandages, compression bandages. You can have also the diabetic slipper shoes and things like that. So it is used on the patients. So another one is called implantable. Implantable is present inside the patients. There are also sutures. There are several sutures. Nowadays it comes under textiles, because the fibers which are used in the sutures are coming from the non-woven non-woven textiles. It is called woven textiles, and non-woven textiles are being classified, because woven textiles is regular shirts and pants that we are wearing. They are all called, and saris, they are all called woven textiles. And the non-woven textiles are also there. The fibers, they are actually melted and used it. They are called as implantable devices like vascular grafts, sutures. They are all used in the it is actually been put in the patients. It is inside the patient's body. It is being put into. Whereas extracorporeal, as you have aware of that, recently Madam Jalilta expired because she was treated that time with ECMO. The ECMO was the one which was supporting her as an artificial lung for her. So that ECMO is extracorporeal medical device or medical called as ECMO. That ECMO contains certain fibers which are used to trap the unwanted material and giving it giving it to the people. It is kept near the patients. So what you have is, you can classify the medical textiles in four different ways. That is, for the patients, on the patients, in the patients, and near the patients. So this, let us see one by one. So hygiene, in the hygiene medical textiles that we are putting it through, here you can see there are different hygiene medical textiles are being given. That is adult diapers, which is for incontinence, that is the urine. Old people, they could not control their urine. They used to have an adult diaper for them to put it through. And baby diaper, as you are aware, and sanitary napkin, and you have some towels, and you have some bed, this one, for the people who are actually they don't even able to control their excretion. They would be able to provide that sheet of a bed bed sheet in that. That also contains a lot of textile material inside. So these are all coming under the things called hygiene medical textiles, but each one of the material has got different parts, and each different parts has got its own quality control parameters to be checked. For example, if you take the case of adult diaper or adult clothing, at least minimum of about 8 segments are there. Inside there is a cuff is there, and there is a band. This one is there is a line of elastic liner will be there, and it will be a clip bandage or like that it can hold it tightly also, that is present. So each one of the material, it is the quality and quantity should be checked before it comes to. These are all different plant. This one different materials, medical textile materials, which could be you will have to undergo several quality and quantitative tests to come before they come out of that. So this quality and quantitative tests are being carried out in Citra as well. For that helps for the people who are in the industry, who are manufacturing industry of in India. They are in all over India. It is the only medical textile division which is present in Citra, because Government of India has categorized 12 technical textiles. They call it as a technical textiles. In the 12 technical textile segments, there are sports tech is there, eco tech is there. There are so many different textiles is there. In that, they have classified one medical textiles group, and that medical textiles group is awarded to the Citra under Ministry of Textiles. So, and regarding the healthcare products, we have also products like surgical drapes, and which is surgical gowns, and the face masks. We have surgical caps and medical shoes covers. All these things comes under medical textiles. This comes under healthcare product divisions. And as I told you, this also has got every one of them, because if it is a face mask, as you are aware that you are using face mask with cotton or with the cloth and all, but it is not the correct case with people who are using in surgery. They require a proper face mask. The face mask should have some blood penetration resistant has to be there. What kind of resistance it has got, and how it is not getting stained, because when you are operating, sometimes some veins or vessels when you are cutting it, it can burst and pierce that blood on the patient, on the doctors. So that patient if it is infected, that doctor also gets infected. To protect him, the face mask and other materials should be of a highest quality. Minimum 3-layer mask means it should have 3-layer. So Citra is certifying that also in collaboration with the Bureau of Indian Standards, because the Bureau of Indian Standards, the medical textile, all the medical textile product standards have been given by Citra to Bureau of Indian Standards, BIS we call it as, and that particular thing is being taken care of by the industries for testing in us. So Citra certified products are are of the higher quality compared to non-certified products. But still, we are also getting non-certified products in the market. But we should aware that a face mask should have at least 3 layers minimum. The outer layer is a hydrophobic layer, inner layers is a hydrophilic layer, and the middle layer is called as melt-blown layer. That is going to be protected. The outer layer and inner layer are not going to protect much. The protection is coming from the middle layer, which is going to be a melt-blown layer. So that particular thing has to be maintained. That quality has to be maintained by the people. Then only it gets certified. And the melt blown has to be in that quality also, the parameters. Each raw material that is being used, at least about 10 to 12 parameters have been studied, and see that that is of highest quality. You see, you can also see that in an operation theater, you can see the surgical cap, there is a surgical face mask, and the surgical gown, surgical drape, and sterile barrier systems like so many different cloths and materials made of textiles fibers. This mostly these fibers are being made by polypropylene and polyethylene. So many PP, that's called as, we call it as a PPE kits. So In the case of next, we are taking to implantable textiles. The implantable textiles, actually, whatever we are going to keep it as artificial ligaments, which ties up between two different bones, which is the ligaments which are torn in sports persons, which when it is torn, it has to be replaced by the artificial ligament. Otherwise, they cannot come into small. You could have had a lot of this cricket playing people. They get into injuries and they get into operation. They say ligament tearing is happening. So if they tear the ligament, what happens is they cannot work for 6 months. To have them work for faster, the artificial ligament is being placed between, which connects between two bones. That has to be placed and connect between two bones or bone and the cartilage muscle where it is being connected. These material are being used from the medical textiles divisions only. But what it should also have some characters. Each medical textile, like sutures or grafts or artificial ligaments, should have. It should be biocompatible. It should be durable also. It can be impermeable, because it should not allow anything to enter into their system, because otherwise it can get absorbed also. There is non-absorbable, has to be that ligament should have that artificial ligament should have that particular quality, and it should also be flexible, and there should be a positional stability. That is, it should not move from the position. Whenever it is being placed, it should be properly positioned so that it should not move. That also creates a problem if it moves. So that kind of characteristics, all these things are being looked into this each and every part of this implantable medical textiles, and their quality. This is about quality, and quantitatively each material is being tested. For example, an artificial ligament will have 1,000 fibers which are intertwined, and it is being done. The fibers are more than 1,000 fibers are intertwined. So that says that such a quality of 1,000 is there or not, has to be measured, and it should be found out. And in case of implantable textiles, which I have told you, there are several also, like there is an artificial heart wall which is magnified here. That also, the wall functioning of heart is one of the thing which is being used in the medical textile division. And this is a vascular graft. When there is a blood vessel blocks or something happening, the bypass issues have been taken care of by the vascular grafts here, and the ligament is attaching this particular thing. And there is also called a hernia mesh. So hernia mesh is the people who gets hernia, they get the intestine protruded out of the system, where they get a lot of pain. So the material which is placed here in this nearby the intestine, where it doesn't allow to protrude out, and if it is stably maintained, that kind of hernia mesh, all these things are being manufactured in Citra also. We have machineries in manufacturing all these things here. And sutures also, we have some quality differences. Like it should have, it's whether it is a natural suture or a synthetic suture, or it is absorbable or non-absorbable, because the sutures, after getting surgery and putting it through, if it is absorbable, it is pretty easier. You don't have to again go to the hospital to remove the suture. So if it is non-absorbable, you have to go and remove the sutures after about 5 days or 8 days or 10 days, depending on the surgery that you are undertaking. And fiber reconstruction is a monofilament or a multifilament, that is also being looked into. So non-implantable medical textile, this is one of the area you might be aware of it. This is like putting some bandages and wound dressings, and you have compression stockings. These things are all putting into non-implantable medical textiles. It is on the patient, it is being used. So the extracorporeal devices that you can see from the photograph that has been seen, artificial lung, from directly the output of blood from the heart, it enters into the artificial lung and gets purified again, pumped into heart, so that the heart is without lungs even, the person can survive by putting this kind of filtration. Actually, if you go through the section of that filter, you can find it out. There are some nanofibers which are present inside. These fibers are made from medical textile fibers, and then these things matters much in absorbing that the material, which is that is by removing the carbon dioxide and replenishing it with the oxygen. It's taken place in this division. Artificially, the lungs is being operated. That filtration mechanism of the air which is being taken care of when the air is coming in and passing it through. When you pump the air, this gets filtered, and then that particular oxygen is replenished in the as a lung, artificial lung. It can function. There is also artificial liver. It can filter it. Artificial lung, artificial kidney, like that. All artificial division has got several absorbing capacity of the fibers, which can be used in the dialysis. For artificial kidney, in the dialysis, it is being used here. Several medical textile parts are being used inside. So, yeah, as a whole, before Corona, actually, before COVID-19 came into the existence, the market of medical textiles itself is coming around 1.2 lakh crore in world market, and it was expected to grow around annual growth rate of around 4.9%, 5%. So even when the world is having that 5% growth, as India, we don't have much of that particular thing. We don't have much contribution to the world in the global medical textiles, except in hygiene and health medical textile. We don't have, we don't even have a non-implantable device called Band-Aid. The Band-Aid, which is actually you are being used in the medical shops and all, it is all multinational companies. It's all being imported. No Indian companies are being making this particular thing. Even recently also we had a collaboration with the TTK Pharma, where they are planning to introduce some switches from Citra to Indian market. They are planning. So not many companies are coming out with those things. So because there are several reasons for it, because even the government support which is required, because there is this particular implantable and a non-implantable, it all requires some money inputs for the missionaries to purchase, to invest so much money on the raw material, because the raw materials itself is not available here. They have to import it. So only raw material which are being manufactured here, the industry can grow. So the government has to take a step and all. I have talked with Smriti Irani on this particular topic when I was talking to her. So the government should support us in doing this particular thing. Then industry may come a lot. Actually, in the case of global market, a non-implantable wound care market itself is around 32%, and implantable devices is around 33%. It contributes the market of this much, and health and hygiene tech. This is approximately this extracorporeal is only 5% of the market value it is going in. But the most important thing is these two, implantable and healthcare and hygiene product, is having a very good growth rate, which can actually be utilized by our government of India. And based on that, we have found out that Indian market, it is known that we have a medtech market growing at the rate of 12% now. We are expecting this to go at 12%. Yeah, so our technical textile, medical textile market is expected to grow at the rate of in the 2023 and 2025. That area we will be touching a very high amount of money. So that we also believe, and also we should know that we are expected to get ranked at around top 3 in the world. Currently, we are having a 6th largest global market for the medical textiles, but currently we are expected to get used into top. We will be using a lot of medical textile products, and we may end up into, after China and the USA, we may go into the top 3, which is going to be possible. And in the medical textile revenue in India, currently what is going on, if you can notice this here, it was in 2010, it was only a 2.9 billion Swiss franc, where it has grown into 10 billion in 2014, and expected to touch 50 billion in 2025. In that, the revenue generated in the manufacturing segment is around 40%, sales takes about 40%, and the new market recreation of the products or investments, that takes about 20%. So the turnover also, see, based on the industries which are present now, see, there are several industries. 65% of the medical textile industries in India are having less than turnover of 2 million only. That is $2 million US, means approximately 20 lakh US dollars. Less than that only, those companies, small companies are there contributing set that even they are mostly contributing in hygiene and health medical textiles and not in implantable, non-implantable. There are very few companies, only 2% of companies are more than 100 million workers there. So, but whereas in US and all, you have several $billion of companies are being put into. So we need to have certain things. What are the opportunities? You can say we have found out what are the scopes is there. What are the opportunities is there? The opportunities, we can say that as many products are imported, and being India is the most second most populous country in the world, and being having a medical tourism and health insurances growing up very highly in India, and people of the awareness between the awareness on medical textiles after COVID, it is even the second and third generation entrepreneurs currently. There is a father is there. He started his mill, and second also that he continued with the mill, and the third person is he actually the third generation person wants to take up a new challenges in the this one that we are able to see it now. There is that we are seeing that several people are coming into us and asking for certain guidances in medical textiles to go into. They wanted to explore new areas, but the problem is they don't have enough funds to create and do that. So such a kind of funds are available with with the government and things like that. If they promote it, then certainly we will be able to take it up further on that. So, and we also believe that there should be a mandatory usage of medical textiles in the government departments has to be mentioned, and total standards has to be strictly followed. The standards which are set by Citra to and submitted to Bureau of Indian Standards had to be followed strictly so that no spurious medical textile product comes into the market. So by government subsidies and creation of center of excellences and mandating the purchase from MSMEs and some schemes like Swachh Bharat and Ayushman Bharat, now we have found out that the medical textiles is growing at the rate of 12% CAGR. But there is one thing is you should be able to know that it is in the business division of medical textiles, when you have a high margin of materials that you are putting it into the market, but that will have only low volumes. Like high margins is most of the implantable materials are high margin materials, and whereas low margins means most of the hygiene and health textiles are coming into low margin, but they can produce in high volumes. The commodity that you wanted to take it up in medical textiles, how much amount you wanted to invest, how much margin you are expecting, and the volume of sales that you are putting it through. Based on that, you should be able to take it up. For example, if you take the case of implantable medical textiles, the capital investment is higher and the profit margin is also higher, and the product demand is very low compared to other divisions. Whereas in non-implantable, it is variable and it is the profit margin is low, but the product demand is high because bandages, stockings, and everything people are started want to use. Common people also wanted to use because it is like a over-the-counter material. You can get it. You don't require for implantable. You don't. The person cannot go and get the material from implantable material from the market because it has to be through hospitals only. Whereas Esta Corporation also, the capital investment is very high, and here the profit margin is also high, and product demand is also high because after so many, because product demand, why it is high? Because so many ventilators have been put into place, so many people are having a lot of diseases and problems that you have to attend them, and putting it through ICU. Most of the ICUs are always filled with either they are with ventilators or with some people are having some ECMO devices attached to them, and so many because we have very nowadays actually ventilators have come out very highly numbers and in hospitals, but previously before Corona we had very less ventilators actually. And in the case of hygiene textiles, the capital investment is low, and profit, you can have variable profit because it can be low or high depending on the product and quality that you are making it, and the product demand is also high. Like that's the same case with the healthcare textiles. So what is the post-COVID opportunities that we may have? See, as you know, COVID-19 affected millions of people worldwide, And the importance of developing our own PPE is the major thing which happened, because before COVID, the PPE were we were not even a single organization was making a PPE with us. And now India, actually, if you take the case of, can say that I have followed, yeah, it has become a second largest producer of PPEs now. So this itself says that we have gone through, because of the COVID, the government support and things like that. People have started producing PPEs. Into 2 lakh PPEs per day is being procured, and we are the second largest after China now, and we are also exporting a lot of PPE kits now outside. So this is how, and this, because the investment is low, and we can have several medical textiles products like respirators, gloves, gowns, surgical mask, eye protectors. So many things have a positive impact in the market. And we actually, Citra has got a ISO, IEC accredited PPE testing laboratory, and also it was the first testing laboratory we had. And then now several testing facilities have been put in through with the government support in all over the places in India. That in a short period it was done. That makes the significant PPE to come. The maximum manufacturers or of PPE kits have come out. And in the case of impact on the COVID-19 on healthcare fabrics in the market, you see there is both positive and negative impacts we have it. Actually, the market is influenced by the COVID infection in people. Actually, it is being such as a person who is already having a disease like asthma and diabetes, they get into more problematic. They get into a lot of ECMO-like devices is being used on them, and that is actually, if you can say, that is a positive impact and in the economy, and negative impact in the health also. So that makes it both healthcare, these healthcare fabrics, it is being promoted, and people should start investing on this particular thing. Investment is more required to make it more cheaper, the products and the things like that, so that common people are not getting affected much on this. And if we say that global market textiles, actually in global, what is after post-COVID, now also they have promoted this only 5%, whereas our own Indian this one market is going to, because they have already grown. They have the medical textile market grow in the US as well as China have already grown. Only India has not grown further. We need to grow further because if we get into 12% CAGR every year, certainly in another next to 5 years, we should be one of the top. We will be top among the leading countries like US and China also. And there is also, we also believe that globally the market is now currently it's fragmented, and it is going to several players are coming into the market, and there is the APSC actually been predicting there is a 40% of the growth is predicted, and mainly non-woven medical textiles like that is used in diapers, that is used because nowadays adult people are more in number. See, because of the medical textiles, actually what happened is there is an increased age, this one, life expectancy has increased because of the hygiene and the medical textiles. That you cannot say no, because earlier we were only using cloths and things like that, and every time we used to reuse the cloths and things like that. Disposable medical textiles, after coming into the picture only, people started using it in hygiene. And then that increased the life expectancy in the last 50 years. About 6 years of life expectancy has been increased in people. That itself says that since the life expectancy is increased, people with more aged people are in the actually been living, and what happens is their problem is more related to incontinence, that is the urine or the fecal they could not able to control. So many people, the number of persons have also increased in those people who are affected with the incontinence problem, and that problem also triggered adult diapers to come into India, and then the market of adult diapers also increased nowadays. So Citra as a this one actually textiles and medical textiles, including the chemicals used on that. But with instruments like latest photographical instruments, mass spectrometrical instruments, all these instruments for testing and evaluation of all the medical textile products and the raw materials can be done at our place. And we have information services. We provide information for people, and R&D also. We develop certain new products also for in the medical textile division to improve the quality of life of the patients. And we also give technical consultancy to the people on chargeable basis who are interested in getting the services from us. And there are several key players. As you are aware, the key players which I am putting it in global, and if you take the case of in domestic also, you see in Apasama Associates and Wellspun India, and Nidhi Beditech Systems, all the others are foreign collaborated. This one, TTK Healthcare to some extent, yes, but most of them have a foreign collaboration or a foreign agencies which has come into this picture. Mostly the here, if you take the case of bandage, you have Johnson and Johnson is the leading person. If you take the case of the raw material PPE fibers, DuPont and B. Braun companies, they are the ultimate leaders. Like that, we should also have become leaders in future. And what is required in our this one is what I believe that is public private partnership has to be put into for embedding sensors. This is one particular area where people can put in using conventional textiles also for medically benefitable, that is also can be used, like putting a shirt and keeping a sensor on the shirt, and if a person nearby you is going to come within 6 feet of yours, then you should give an alarm. Like that, you can have embedding the sensors for that. And what also we can think about it is like compression stockings, which can be coated with pain killing medicines inside, so that the compression stockings not only compress the giving a compression feeling, or even knee pain people who are having the belt on the knee, they can have a pain relieving medicines embedded on that, so that the pain relieving medicines are being slowly putting it through the skin to the patient, and pain also relieved at the same time, the movement also been properly done with the belt. So like that, we can think about embedding sensors, embedding pain medicines inside the stockings, and non-implantable medicines we can put it, and implantable medicine also we can also have some of the even sterile material with the even though we use vascular grafts and sutures in sterile conditions, but there is a chance of getting a contamination when you are opening it and bringing it, because operation theater is not 100% safe for microorganisms even. There will be a chances of getting infection also. For that, you can have antimicrobial compounds or antibiotic compounds embedded in the sutures, which can be also been used for creating new materials in the medical textile divisions. And government public private partnership has to be promoted, because government has to give us subsidies and public has to be involved in putting their money into this one, and private also should start manufacturing and doing things for creating new products. So like that, there should be a partnership between all this, and we can also think about having multinational companies coming into India for collaboration with both in public and private enterprises. And we can also think about the government and private creator of Meditech zones, which I have put in through about a month or 2 months back. When I spoke to her, I was talking to that, and immediately in the budget, I was told that 7 Meditech zones are being created, are going to be created by this government in all over the country. That is what we've been put in through. So 7 technical textile zones are going to be created. In that, our Citra is pursuing to get a Meditech zone here in Coimbatore. And we also have government and R&D lab in public. that also should have some collaboration to create new standards in collaboration with international standard formulating bodies. Because the ASTM is the one of the American standard testing methodology. Is one of the very big the standard formulating body, which is actually that kind of thing we are going to replicate it in India also. We are trying to make that ASTM compatible this one, because we have created more than about 37 ASTM standards for Indian context of medical textiles. Like that, we wanted to make more further in the future by collaboration with them. And what Citra can do it is, we can create a detailed project report, and we can create training and production facility we have, and we have what the material, the products that we have is all listed here. The healthcare divisions, we have Biofon Corp, surgical aprons, shoe cover, surgeon's cap, face mask, bed linen, pillow cover, wound dressings, reusable wound apparels. All these things, machineries are available in with Citra. As well as also in hygiene, we have adult and baby diapers with the sanitary napkins, all in a one particular machine, which we can be making it. Alcohol swabs and wipes, disposable underwears, and underpads also can be taken. And non-implantable, we can also have compression stockings, crepe bandage, surgical cotton, surgical gauze, cotton ball, cotton pad. All these things can be also made with etc., because we already have a detailed, either we have a detailed project report, or we have a production facility, or both commercially and pilot also. And implantable also, we have hernia and suture, we have a bobbed and non-bobbed sutures, and ligaments and vascular grafts, both fiber-coated and straight. And we also have this one, shoulder cuff also we are planning to put in through now. And mostly what I talked about medical textiles and this one, before I complete this one topic, actually I was told by madam that I should be speaking around 45 minutes, but since just now I saw that and found out to be it's 1 hour and 15 minutes my talk should have been. So for that particular purpose, I have added few more slides here, because I want you to know one particular disease called lymphangioliomyometasis. This is called as one of the problem associated. Actually, I found across one patient who was actually had this particular problem. This called, classically they are called as LAM. LAM is in short form they are called. It is a lung disease. Actually, the lady, 25-year-old lady, she was affected with LAM in PSG hospital. Before that, she was actually been affected with the pulmonary tuberculosis, and then in January 2020, she had pulmonary tuberculosis, and she got into that LAM disease in the month of April, which I am going to talk to you a little later. First, before that, you should know what LAM means. That when the muscle cells in the lung tissue, they grow out of control and form cysts, which eventually damage your lung tissue. That is, the cysts that are formed over the lungs gets broken during the menstrual period time, because it mostly affected the girls and women. So what happens is, the cyst which forms on the lungs, it gets bursted out and form a hole in the lung, and the air which is sucked by the people to the lungs, it gets escaped out of the lung, and in the cavity it accumulates and started pushing the lungs, called that particular problem is called as collapsing the lung. That collapsing in the lung is the most major problem, because that creates a lot of problem, because the patient cannot breathe. So the ventilator is always put into. So this particular problem is having, people believe that there is a change in the sclerosis gene. That could be one of the reason, and during pregnancy and menstruation it becomes worse. That's why it is related to hormones, and so many theories are there. See, let me put you one girl who was actually in January 2020. She was actually been associated, got this disease called pulmonary tuberculosis. This pulmonary tuberculosis she affected, and after 3 months or 3.5 months, when she was having breathing problem, and when we checked it to PSG hospital here in Coimbatore, she found that there is called pneumothorax. This is what the condition called collapsing the lung. The collapse pneumothorax, right lungs of her got severe pneumothorax, and she was put in ventilator, and there were few cysts intercommunicating with the bronchi, that is in the lungs, and no lymph nodes was found at in 25th April. Whereas, so immediately she was classified as cystic lung disease, and her tracheal tube is being placed with the oxygen therapy, because there is a tracheotomy was done directly from the throat. A slit is made, and then directly the oxygen, the air is actually when oxygen is being given through ventilator through that tube. Because she was not able to breathe properly. In the 17th July, after 3 months of hospitalization, during the period she had spent about 33 lakhs in the hospital in the ICU, because she was always with this one ventilator, and this one actually they were all increased in size. The pneumothorax have increased in size. Collapse condition, as new collapse conditions are coming out, and few cysts, several cysts have started growing, and lymph nodes also have been started coming out, because there is a thing called there is a problematic on her lungs of my drug for asthma, which I was doing it, herbal drug, which I gave to people free of cost from my office. So those people actually wanted to take my this one asthma drug for her benefit. When they came and approached me, I told them that I'm not too sure about my drug being working on this particular disease, because this is more life-threatening disease, and that girl was actually been suggested that she has to undergo a lung transplantation, then only she can be able to survive. So that kind of situation, I don't know whether the herbal drug will do, but I have told them that nothing harm in trying. I will also add few more extracts into that, and then I have started giving that medicine from 23rd July. On 12th August or 15th August, she has again diagnosed, and then found out to be her condition improved, and she was actually being asked to go home. She got discharged from the hospital, but she was asked to continue the oxygen therapy in the home also. She was continuing. Actually, the last about November, this is actually when this slide was made in November. This November, after 2 months of this one, her pneumothorax have been 100% resolved, and the cyst that was formed, it maintained. It did not go through finer. It was not bursting out and forming a hole in the lungs. And her lymph nodes were actually been resolved within 15 days of our drug given. And I was also very shocked, or pleasantly shocked, to listen that she started breathing without oxygen support after 30 days, because as her tracheotomy also have been closed down. The open tracheotomy was closed down, and she was stopped taking TB medicine even after 75 days, because January she had the TB medicine started. Actually, the TB medicine is given, if people come to know, they used to be given within, for 1 to 1.5 years minimum they will be given, but within 10 months she was asked to stop the TB medicine, because her lung condition improved. And what she was having weight at that time of April, about 38 kg, in 3 months time she was lost from 55 to 38 kg, and now she is having 51 kg. She has improved. She is going for job and things like that. This, why I am saying this, is being a this one, you should see that if there is an opportunity for you to do certain things for people who are in suffering, then you should be able to put it through for them to get benefited out of the herbal drug even. Normal herbal drug even can do wonders if you do that. But after that, I came to know this particular drug. Actually, I have made this drug, one of this, after presenting this in one of the conferences, one industry person has come and approached us, And for them, I have done based on this. I have created a formula for COVID-19. That particular formula is going to be launched in the next month. Actually, that particular drug, actually, I am being manufacturing the drug for them, and then I am supplying to them. So this also I am doing it. Actually, that particular drug is going to be very costlier one. They are going to come out with that. That's going to 120 capsules is going to cost about 10,000 rupees. I was told, because the company which is going to take it up, it's going to make it very serious effort in making this drug to come. And also they are planning to give it for some of them as a charity also, so that the costlier one is being sold to the people who are rich, and this one, people who are under distress, can be given at a subsidized rate. So with that, I think I would like to complete that my talk. Another 10 to 15 minutes, I'm expecting some questions to come in, so that it would also benefit people.
Yes, sir. Thank you so much. It was a wonderful presentation. In fact, giving us a panoramic view on different types of medical textiles, and also giving us an awareness on the trends, market trends in global and Indian scenario. And we also understand that it is a need of the hour to set new standards and high standards for developing certified healthcare products and explore opportunities in medical textiles. And hopefully we become lead players in this area. And before that, sir, let me congratulate you on the new drug that you have developed, and all the best, sir, for and hopefully we'll all be benefited out of this new drug for against COVID-19.
Thank you, madam.
Now the session is open. You can post your queries in the chat box. You can also interact with sir. You can unmute and you can interact.
Hello. I have two questions shared to me by the students.
Yeah.
So the first question is, there are many surgical masks available in the market nowadays because of this COVID situation. The question is, are they efficient in controlling viruses?
Yes, there are certain masks which are controlling, because we also test for antiviral as well as also antimicrobial. There are several face masks which are not even tested. Actually, even there are also single ply mask, double ply mask, even cotton mask, the cloth mask and all there. Those cloth mask and all, it will not serve your purposes, though it can protect to some extent from 25 to 50%. The exposure is protected, but it will not be filtering microbes. It will not be filtering the virus at all. The thing we should have is a melt-blown layer has to be placed in between. That is, in between the face mask, first layer and the second layer. The middle layer is the most important layer, where it should have the melt-blown layer. That melt-blown layer should have is having the antiviral. That kind of thing, melt-blown, if it is not present, then your mask is as equal to any other cloth mask. So the melt-blown layer has to be placed, and that only is going to protect you from microbes and antiviral. So you should ensure that there is a 3-ply mask, and in the 3-ply mask, in the middle layer is a melt-blown layer. Unless you see that and then it is taken, that is, or otherwise you can also ask for Citra certified mask. If you can ask for Citra certified mask, unless 3-ply is there and the middle layer is melt-blown, the quality is not being matched, it will not be certified by us. Even you can see in Amazon also, Citra certified masks are available. Citra non-certified masks are also available. So based on your choice of preferences, you can have both. All the masks has got filtration efficiency, but the best filtration efficiency should be having that melt-blown layer in the middle.
Thank you, sir. So the second question to you is, why are we still importing surgical or medical garments and band-aids? Is it because of lack of research and development in this field?
Yes, certainly. Lack of research and development, lack of standards, lack of industry partners who are coming in, lack of support of government so far. And all these things would, after this corona, I think these are all things will go away and people will start looking into it. That's what my thinking is actually, because after COVID, because of the necessity for PPE to come, we have been able to make PPE and becomes the second largest producer now. So if the demand is there, then people will certainly go into the industry, will certainly put their money into it so that they get profit out of it. That is also being taken care of.
Thank you, sir. So the participants, if you have any more questions, you can you can ask your questions directly, or if you want to put the message in the chat, that is also fine. So I think that is all we have. Thank you very much, sir. It was a very valuable session and we learned a lot about um, medical textile, and it was very useful for us. And it was the need of the hour, with the current pandemic situation. So thank you very much.
Thank you very much for giving me the opportunity for the management of Neuro Arts and Science College and Professor Dr. Nirmala and the Department of Biotechnology and the students and the faculties who are involved in that. Thank you very much for giving me the opportunity.
Thank you, sir. We now move to technical session 3. The topic is COVID disease management in diabetic patients by Dr. A. Murugan. May I now invite Dr. V. Shanmugam, Associate Professor, Department of Biotechnology, to introduce the speaker.
It's not in, the moment is not available. Sir, Franklin, no, sir.
Yes,
sir,
yes.
Dr. Murugan has not joined, it seems, sir.
Okay. Okay, then we'll wait for him.
Yes,
Can
sir,
somebody
yes,
inform him that he
he asked me to
about the
put the
situation?
message. So many
Yeah.
times he has tried.
Yeah.
As soon as he joined, I'll just convey to you, sir.
Sure, sir. Thank you.
Okay.
Participants will start shortly. We are just waiting for the speaker to join. Thank you very much. Kindly stay on. Please do not leave. Thank you. No, that was. Guys, the technical session 3 on the topic COVID disease management in diabetic patients by Dr. A. Murugan will start shortly. The sir is joining. All right. Please do not leave. Um, the speaker for the technical session 3 is having some technical issues. He'll be joining very shortly. Please stay online. Thank you. The resource person will join very shortly. Thanks for your patience. The meeting will start at once. Just 2 minutes. Thank you. Hello, Murugan sir.
Yes, sir. Good afternoon. I'm
Good
available.
afternoon, sir. Good afternoon, sir. Uh, Participants, we are now entering the technical session 3 on the topic COVID disease management in diabetes patients by Dr. A. Murugan. May I now invite Dr. V. Shanmugam, as Associate Professor, Department of Biotechnology, to introduce the speaker to the audience.
Yes, sir. Good afternoon, sir. Good afternoon, Professor A. Murugan. Good afternoon, sir.
Good afternoon, sir.
With immense pleasure, I introduce Professor A. Murugan, Department of Microbiology, Periyar University. Sir did his MSc degree from Sri Paramakalyan College and a PhD in Manomaniyam Sundarnath University. Sir started his career as faculty in self-financing colleges. In 2009, he entered in Madurai Kamaraj University as a teaching faculty. His area of interest are microbial ecology and bioremediation, microbial genomic studies in polluted soils and microbial conversion of waste to wealth. He has guided 8 MPhil and 4 PhD scholars. He got research grants from various funding agencies. He has organized international conferences and workshops. His research findings are well documented in leading peer-reviewed Professor A. Murugan, leading microbiologist. Please, sir. Thank you very much.
Sir, thank you, sir, for your nice introduction. In fact, I did not give even my short biodata you have taken from somewhere. It's a great to be with you all in this August gathering. In fact, this COVID disease researched, and it's going to be another big problem. Sir, am I audible to all?
Yes, sir. It is audible, sir. Audible, sir.
Yes, sir. Yes, sir. Yes. So in a way, it is better to learn little more on the management of disease. So we are going to have 1.7.7. That's going to be severe. There too, this time the symptoms is going to be unique. People believe this mutant will have a different, kind of episode and pandemic with in the Indian continent than the previous virus. So with this preview, I would like to just throw light on COVID disease management in the comorbidity cases. So like I'm going to cover CVD as well as the diabetics. As you all know, this is the incidents which we have witnessed last January, meaning 2020, January 7, the sample isolated from Wuhan, China, had showed positive result for SARS-CoV coronavirus 2. Then it was confirmed as COVID-19 by 11th February 2020 by the WHO. Later, by 12th March, WHO just declared this COVID as a pandemic, and we were in the different, lockdown. And by the 15th September, there were about 29.5 million people were contracted with this virus, and about 9,33,000 people have lost their life. The number almost is approximate, I believe. That nowhere the right number was taken. As off the record, we can just get to know this. This is the highest case of fatality recorded during 22 February 2021. As per this record, the disease prevalence were widely different in the different continents. When you see this data, it was highest in Europe than the Southeast Asia and other Asian countries. But this data is very unique with Singapore. When there are 23 people died, out of which the 58 was the youngest one to die in that. So almost all the people who have died for this COVID at Singapore are all elderly people, and they also had comorbidity symptoms for one more diseases that we're going to see. That is the topic of the day today. So before we go into the details of this disease management, let's have some idea how this virus is going to infect and what are the other organs being affected. So as you all know, this virus SARS-CoV or COVID-19 uses ACE2 receptors. The ACE2 receptors are high in visceral organs like heart, kidney, and the endothelial membrane of the small intestine as well as rectum. So after the entry of this virus, there are many factors contribute for the higher production of ACE2 receptor. That virus enters into the host cell, multiplies in large number. That was the very tricky mechanism used by this virus. Otherwise, we will not experience this kind of severity with the viral replications. Okay, it is very, very unique with this coronavirus. And also it impairs many of the immune responses, especially the CD4 and CD8 cells and T helper cells populations are also going to be unique and very, very low in number. Correspondingly, it also increases many other cells which are responsible for inflammations, especially interleukin 6, interleukin 12, and interleukin 1, and TNF factors. With this, very abnormal condition, it makes unusual conditions of excess cytokines like interleukin 6 in excess number. That is called cytokine storm. Okay, unusual production of the interleukins are lead to a dysregulated immune response that causes inflammation. Okay, that inflammation causes the dysfunction of all other organs. So, that is how reported in different cases. Almost about a million cases have been tested, and with that million cases, the complications were recorded. Okay, especially the people who died of this COVID had diabetics, CVD, and other kidney diseases, and a few of them also showed positive for obesity. That is how pre-existing comorbidity cases were high among the COVID patients who died by the viral disease. So here, what I wanted to just insist is that the diabetic is one of the major issue which causes mortality in this COVID cases. That is very important prognostic marker for poor COVID outcomes, especially higher BMI, ALT, alanine transperases, then CRP, reactive proteins, and CD4 and CD8 ratio. It reduces actually pro-inflammatory cytokines, as I said, interleukin 2, interleukin 6, and TNF alpha, dimer levels, and IF and gamma levels, and lower. Now this is glomerular filtration rate. Actually, the filtration rate reduces just because of the viscosity of the blood. Okay, let's see what are all the factors contributes for the viscosity of the blood, and also the peripheral count of the CD and for CD8 T helper cells and other lymphocytes drastically reduces. And very interesting data also says that the most of the people who died for this COVID are all male gender. Okay, it is very interesting data. There are about 67 among male and about 33 female. That is the data we have this, right? So on this, just to show you what happens exactly in the hemostasis, meaning altered hemostasis in the human physiology with respect to the glucose availability. So just to give you some information, just have taken this slide, single slide is standalone. So this is about the diabetic cases. Almost 425 million adults being affected by this diabetes mellitus, and it would reach 629 million just 25 years. It is very alarming situation. It's going to be a disease. Okay, now it is a metabolic syndrome, metabolic disorder, right? In future, it's going to be a disease, and it's going to affect this country because of the complications, and we will be losing a great workforce. You see, the age groups are very, very active groups, 20 to 79. So we need to take some active steps to curb this and control and to have a healthy citizens. So my end of talk will give some insight how we can protect ourselves and live a healthy life with a normal metabolism. So in the diabetic cases, what is the major issue? Is insulin secretion. When there is a high level of glucose, insulin is secreted. Insulin acts by increasing glucogenesis, lipogenesis, and glycolysis, which will take the glucose into the cell. By that, it reduces the glucose level in the bloodstream. But in the insulin resistant cases, this is not happening. So people with the diabetics will have a altered metabolism, which affects not only glucose but also the excess of protein discharged through kidney, people get a kidney problem, and also so much of lipids. Glycogen. The stored glycogen as well as the fat present in the liver also being hydrolyzed. So this causes many other problems which are going to see. Acidic blood, ketones in the blood that we are going to see in detail. So these are all the side effects. And these side effects alter rest of the metabolism. That is one such alteration is glycosylated hemoglobin. Diabetes mediated glycosylation of hemoglobin. Hemoglobin, we all know it's a very important role played. It takes the oxygen from the lungs to the every cell and supply energy. Right? When the hemoglobins are loaded with you know, uh, this glucose, it forms ketomine. This ketomine is unable to carry oxygen. Such deficiency leads to formation of lot of you know, deficiency for oxygen and energy synthesis and controversial. The carbon dioxide present in the cell also not taken back to the lungs and released. So we have another severe consequences. Another important complications is that the presence of excess glucose in the blood produces black acid. It starts when the body starts breaking down its own fat present in the liver. Okay, it produces so much of ketones and that produces acidic blood. Okay, this and the condition occurs when there is not enough insulin in the body. It triggers all other infections and illness. Like this diabetes ketosis and ischemic heart, leads to the heart diseases. That is one of the major reason for the people who are diabetic also prone for cardiovascular diseases. And most of the people who died with COVID who are also positive for diabetics are prone for cardiovascular disease, no doubt in it. The research indicates that around 32% of the people experience adverse effects with the COVID that are known as long COVID. This long COVID is due to the multi-organ failure. This multi-organ failures are due to the excess presence of the cytokines. Okay, all these cytokines as well as the defect in the folate production. That is another impairment in the thymidine and purine synthesis, which leads to lack of cell division and hematopsis and immune cells also will not form. Okay, it also causes the malnutrition. Why I say malnutrition, you will understand better now. See here, you see this methionine. This methionine produces vitamin B12. Through this vitamin B12, we get the folate, which is the basic molecule for the DNA, RNA synthesis. Right? When you don't have this vitamin B12 is the key factor. Okay, when you don't have this vitamin B12, you don't get this folate produced. When there is no folate, okay, DNA, RNA synthesis will also be blocked. And another feedback mechanism also is that the excess accumulation of hemocysteine, which is opposite of the vitamin B12 production. When there is no vitamin B12 production, hemocysteine accumulates. Otherwise, this hemocysteine will be converted into tetrahydrofolate in the presence of vitamin B12 and become a DNA or RNA, whatever things. So in a way, this the amino acid metabolism functionally affect the production of DNA, RNA, and protein, but thereby there is a defect in the cell synthesis or cell division. Okay? In addition, I would also like to just inform you that diabetics, meaning the excess presence of glucose in the body, causes three important factors. Three important phenomena were observed in the diabetics cases when they were contracted with COVID. The presence of glucose favor the viral replications, meaning the immune cells which are essential for their replication also increases, and the viral infected immune cells also produces reactive oxygen species. This reactive oxygen species again damage your lung. Again, the virus residues have the ability to suppress and kill the lymphocyte, especially T helper cells and CD4 and CD8 cells populations goes down. High level of glucose affect macrophages and monocyte activation. So by the previous mechanism, presence of excess glucose and two more factors which I have learned have positively increases the ACE2 production that we are going to see in the last but one slide. The ACE2 production is enhanced even in the macrophages and monocytes, wherein this virus binds and makes them susceptible for the infection. Macrophages are the ideal place for this SARS-CoV virus multiplication. This is how it is going to affect the glucose, excess glucose presence, going to affect the viral replications, meaning that it favors positively and negatively affect the immune cell proliferation. So the potential pathogenic mechanism of COVID among the diabetic mellitus cases, the high amount of cytokines which are responsible for inflammatory responses, and also excess presence of this liposaccharide, okay, positively produces angiotensin and ACE2 receptors. Okay, so this leads to lung fibrosis, and the acute lung damage leads to the distress syndrome. People cannot just breathe normally. Similarly, excess of this ROS and excess of interleukin 6, I was telling you just 10 minutes before. This interleukin, this is a part of the cytokine storm because it causes hyperglycemia. This hyperglycemia is responsible for thrombin accumulation as well as cardiovascular disease, and also it causes high mortality. So again, you see this ROS and six causes insulin resistant. This includes insulin resistant cause vascular endothelial damage that contributes to vascular disease. Similarly, this fibrinogen and the dyma increases see presence of excess this peptide and fibrinogen in the blood causes blood viscosity blood heart attack. Right? Would increases the dysregulation of glucose metabolism, meaning it causes the less uptake of glucose. All the glucose will be used for the energy synthesized for the cell for supporting viral replication. That is how it's called and diverted. And endothelial damage and thrombotic risk that leads to CED, cardiovascular disease. Again, same thing, such receptor for their binding as well as entry. Okay, for instance, this cholangiocyte, lung cells are basically, and smooth muscles, and endothelial cells, right? And enterocyte is called enterocyte, monocyte, leukocytes, every cell, right? In the renal and cardiovascular system, gastrointestinal system, and every system, this ACE2 is produced. This ACE2 okay, serve as a receptor for this virus. This virus bind to them and just messenger. Okay, very important observation that COVID positive cases will have continued in the area. For that, what is the main reason was observed is the smaller intestine which contains enterocyte, okay, will be bound by the COVID. That causes very heavy inflammation. That inflammation causes diarrhea. The same thing also observed with renin-angiotensin system. Basically, here you could see how this angiotensin bind and what are the immunological responses can be observed is shown here. You see here, when this angiotensin is bind with the virus, you will metabolism of the system will be against any viral infections, right? So angiotensin, most of the angiotensins are involved in the protective mechanism, meaning anti-inflammatory and the control of ROS formation. All those is associated with the ACET receptors. So in the case of COVID, many of the bacterium, which are all pathogenic bacteria, I would say, or we can call them opportunistic pathogens, but they are not our normal flora. So these opportunistic pathogens also have contributed the excess production of ACE2 in the urine gut, meaning the intestinal gut experience the excess ACE2 production when there is Caprobacillus species, which is opportunistic pathogens. It is not a part of your normal flora. So along with this bacteria, there are many other organisms, non-human flora. They are also contributing such excess production of ACE2. Hello, sir, am I audible?
Yes, sir, you're audible. Please
Yes.
continue, sir. Hello.
Yes,
Sir,
sir.
you're
Yes, sir.
audible.
Yeah. I think I was also having some monitor, but the monitor did not produce noise.
Your PPT is also visible, sir. We
Yes,
can
sir.
follow
Yes, sir.
along.
Yes, sir. Yes. Hope it's going well.
Yes, sir, it is going well.
So this ACE2 reduction is also increased by some of the bacteria which are not normal flora. That's what I wanted to insist on here. So when we have a right bacteria as a gut biome or normal flora, we will not have this symptoms like cytokine storm is a critical life-threatening and overwhelming inflammation and hyperproteinemia and hemodynamic instability and multi-organ failure. All this is all due to the excess production of three important culprits. They are interleukin 1, TNF alpha, and interleukin 6. So these three culprits are being produced in excess when there is a COVID infection, and also when there is a dysbiosis. I use a right word called dysbiosis. When we have altered bacteria in our system, it is said to be dysbiosis. So individual gut microbiome may affect how the body responds to SARS-CoV infections. When we have a right bacteria, the response is going to be different than the altered condition. A gut bacteria might influence both short-term and long-term effect of infection. For instance, even in the COVID cases, this gut bacteria is playing a major role in recovery from COVID. The people who had dysbiosis by various means, like they were given antibiotics, they were given different other chemical in order to treat the COVID. They had a dysbiosis. So dysbiosis can contribute to the development of many health disorders, especially it affects the total normal function of the body. So just to understand this concept, I would like to just deviate a little, some 7, 8 slides, and then come back to the COVID. Right. So I'm going to, with your permission, I'm going to just jump to probiotics. So when we understand probiotics, we'll better understand the dysbiosis, and then we'll learn how we can restore our body health. Okay, even any kind of pandemics or any kind of abnormality. So these probiotics are living microbes, which we just usually have every day. A meal, or nothing but in North they say taki, or in Tamil it is tai. So this greatly help in improving the intestinal microbial balance. And not only that, they contribute at large for the recovery of many disorders. I would just take you through a few important concepts of this probiotics, and then we'll learn how we can use this probiotic to recover from the COVID. The probiotics are by the term coined by Lily and Silver. They are both good partners, husband and wife. I believe they lived in the 19th century. And these people have coined this term. But the concept was brought to the scientific arena, or to the better understanding our, the father of immunology, Eli which now and his friend at Louis Pasteur were working together, and they understood the fouling of milk was caused by some acid producing bacteria. This acid producing bacteria is able to just maintain a better health. Later in the year 1930, a Japanese, his name Nozoro Sorota, developed a milk product called yogurt. In our terms called yogurt. It is made up of fermenting a mixture of skimmed milk with lactobacillus. As say Savota, they earned the name by the other who developed this culture or yogurt. serota. So this normal bacteria were very, very critical in keeping our health normal. It is known to produce a lot of vitamins, especially vitamin B12. We are enjoying from this E. coli, which is residing in our intestine. Similarly, it also just to prevent escape from this severe diseases. I believe I missed one slide. I was just listing the top 10 diseases which causes great human death. So that cardiovascular disease came first, and then the eighth place for diabetes, third for cancer. Okay, obesity comes sixth. So likewise, neurogenital disease in the second case. So that is how the top diseases which claims large number of human lives, like CVD, can be controlled by your normal flora or the probiotics. So these are a few examples to know what are all those probiotics. All of them are just lactobacillus species. We usually have a planetarium, the normal one which we have in the curd, as well as the lactobacilli, casei, subspecies, ammosis, and also brevis and acidophilus. Right, and the pyrobacterium, another important bacterium. There is a amino acid metabolism also in there in this bacterium, pyrobacterium. Okay, and other organisms are in the normal flora include Streptococcus, Salivarius, Lactobacillus, and Enterococcus, and Propionibacterium, and Pediococcus, and Saccharomyces boulardii. Apart from this, in many countries, people develop this lactobacilli in different combinations. It is available in the market in different forms. One such one is Bionta, which consists of three different the probiotics. Similarly, acidophilus pure lactobacilli, acidophilus and Pyrobacter longum, and similarly Theotolpilus, lactobacillus, acidophilus, Pyrobacterium, Pyrobacterium longum, and simple live activated probiotics. So these are all very important probiotics like lactobacillus plantarum, lactobacillus acidophilus, lactobacillus casei, and enterococcus PCM. All each has a right role. All of them just contribute for the good health of the human being. So thus, let's see how these bacteriums are residing in our body, in what number. Likewise, as you know, it is very the genome. It is one very common in mouth, starting from Denicos, pollen. We have almost a number of 14 in the intestine, but the total number of human cells is only 10 to the power of 13. So these bacteria are tenfold outnumbered than the normal human cell number. So this is how we have almost higher number of the bacteria in our body that protect from all sort of problems like aerations we would say. Right, so no site is open or free for any kind of bacteria entry. That is how they are lined up and just to protect from the disease causing pathogens. Right? I would recommend all these people in the platform listening this lecture must take probiotics in the morning food, right? Because we almost lose 30% of stuff. It is the bacteria in the morning cleaning. So when you just refill by taking at least 100 gram of the tagi or curd, you would replace and you will maintain a better rate. So probiotics do not permanently adhere in the intestine. Okay, it is this time. Sorry, it is vast, you know, a good number of bacteria, right? So there is a connection, right? So your mental behavior and probiotics, prebiotics, what you eat, okay, and all your habits contribute directly or indirectly the loss of the colonization. The daily consumption of this bacteria probably best way. So this is to show you how this bacteria help in improving our metabolism as well as the good health. For instance, you can start from anywhere. Lower level of toxigenic mutagenic reactions that are faced by the probiotics. Reduction in the risk factor for colon cancer. Right? Even if you take any poison, a lot of poisons are detoxified by the metabolites or bacteria. Beyond it only we have an issue, right? Apart from this, they also produce vitamins and the short chain fatty acids. Okay? For information, all your body is maintained by a lot and number of the short chain fatty acids produced by the probiotics. Okay, these short chain fatty acids are not produced by your DNA information. Right? Most of our metabolism rely and dependent on the probiotics. If you don't have probiotics, you fail to maintain good health. That's what I would say. So lactose hydrolysis improve lactose tolerance as well as bile salt deconjugation and secretion, and it reduces cholesterol. Right? People who take this regularly, this probiotics will not have, I would say, okay, with a lot of authentication, they will not have cardiac problems because that much safety and precautionary mechanism existing with the calcium fatty acids produced with the probiotics. Similarly, also suppress the indigenous pathogens and antibiotic associated behavior, meaning there will not be colitis, right? And also control of irritable bowel syndrome. You see, people mistake with prognosis as well as the diagnosis. People believe diabetes is inflammatory disease. Yeah, of course, inflammatory disease, but the factor responsible is due to the absence of probiotics. Okay, likewise, you have a lot of positive connection with good health and probiotics, and also priming for health. Gut bacteria acquired in early life regulates physiology, brain activity. And we really believe in the mistake. Okay. This will contribute the behavior. The behavior again regulated by the probiotics. Again, brain development, it is again regulated by the gut bacteria, and also the physiology is still maintained by the bacteria. A normal gut bacteria modulates when I have a ample number of papers saying the mother mood and diet when she was carrying the embryo. Okay, regulates, maintains, and supports the brain development of the child. Similarly, microbiota modulates behavior, physiological abnormalities associated with the neurodevelopment disorders. So the study goes extensively on how this normal flora vary in biodiversity immediately after the child born and the last birth of the human being. Right? You could see the actinobacteria and bacteroids are different in number in the earlier case, which is going to just opposite in the elderly stage. Right? You imagine firmicutes are more in the elderly stage than the baby who harbor this number. Right? It's going to drastically altered when we grow, when we just maintain the different habits. Right? And this is to show you how this bacteria helps in maintaining our physiology, especially many metabolites from the bacteria just keep away these pathogenic microbes, and then they help in digestion of food. They also synthesize essential amino acids, and very critically few carotene and many other things are being suppressed and out metabolized by the probiotic. Otherwise, you will produce TMG, uh, trimethyl amine. Trimethylamine becomes trimethylamine oxide. Trimethylamine oxide becomes sclerosis, meaning that it is going to cause CVD. Okay, this carnitine and the other factor responsible for TMAO are all common in red meat, right? So people who are non-vegetarian should mind this. Similarly, to protect the epithelial cells of the gut, and also it stimulates your immune system. So this picture is to show you that the individuals differ in their metabolism, differ in their language of their health status. That difference is again due to the difference in the microbes. When you have a good microbes in a balanced state, you will have a good healthy state that is going to always keep you up in the health status, okay, than the other one. Okay, this is the same language. When you have a good bacteria and right number, you'll be active, you'll be just healthier. If you don't have this good bacteria, and you will suffer with all sort of infections like IBD, diabetes, sort of the so I have also listed what are all the good bacteria is supposed to harbor. What are the bad bacteria which replaces the good bacteria is in the right side. So it is all Enterococcus faecalis, methanol, Bacillus timidity, and Clostridium. See, this is the last two, Clostridium difficile and Campylobacter species are the real culprit with CVD and other IBD cases. Okay? So I have also listed the diseases which are all related to biases, right? Influence on the immune system, antibiotic resistant, it causes also multi-organ dysfunction syndrome. When you have a altered bacteria, you will have the following diseases like the obesity, inflammatory bowel diseases, psoriasis, arthritis, and diabetics, type 1 diabetes, and ischemia and colic diseases. Right? So one would ask, what can you just tell me? Always keep my body healthy, right? And also, what are the bad bacteria I suppose not to have? Okay, if at all I have, what will happen? So all this can be understood from this slide. Gut microbiome has been reported to play a major role in the pulmonary immunity as well as the visceral organ health, where the formicutes and bacteroids are the more predominant which helps in keeping our physiology hemostasis, meaning all the essential metabolites will be available for the betterment of the organ function. Right? If at all any deviation that leads to normal, abnormal function, or constant promiscuous bacterioids and protobacteria are good in lungs. If this bacterium reduces, right, I'm not just spell out this name of the organism alone. Rather, they carry a protein, lot of you know produces acetate and butyrate. Okay, butyrate, acetate, propionate. You can Google it. These are the three different metabolites produced by this gut bacteria responsible for every organ's function. Right? If any imbalance in this butyrate and propionate and acetate, you will end up with multiple organ failure. Okay, so one should have the orderly concentration of these three. Otherwise, there will be a lot of issue, right? So I can speak on these three compounds alone forever, right? If time gets, we have another day with the students in Nehru College. This, this gut-lung axis allows the transport and diffusion of microbial metabolites, exotoxins, cytokines in the bloodstream. Okay, and maintain hemostasis, meaning it keeps them healthier and active. If at all any deviation in this concentration, for instance, you have more of renin, and that is a problem for us. More of menon or more of okay, all those will lead to inflammation. I believe you could recollect we have an alternate complement cascade system, menos binding the pathway, right? So the presence of unusual bacteria which contain more of mannose will also lead to inflammation. So IBD as well as inflammatory disease are all caused by the presence of the excess number of this bacteria. Right? Few reports also evident that involvement of toll-like receptors, T cell subsets, okay, and the inflammation cytokines. Right. So we have a unique project running in our laboratory that a few of the metabolites responsible for postponing our life, meaning one can live almost 130 years, meaning almost 500 times than the normal with the unique metabolites which react in the toll-like receptors. Okay, that is important thing. You can also Google it. TOR, toll receptor, and plus extended lifespan. So crosstalk between the intestinal microbiota and host modulates the mucosal immunity and systemic inflammation. As I said, this short chain fatty acids, which are produced by the microbes, greatly helps in maintaining our health. Especially, you see, butyrate will promote the formation of regulatory T cells and T helper cells that contribute to the extended life, right? Especially how they give extended life by maintaining hemostasis, intestinal part, and that helps in this, right? I'm not going to the details of this, but however, the altered bacteria use a different amino acid. Based on the amino acid, the individual will live for different period. Individuals ordered by insulin resistance. See, when you have less of this isolation, you will have less resistance. When you have more isolation, you will have a more diabetes. That is the finding of this research, right? And I was telling the importance of the bacteria reducing the health status of the individual, especially the people who had a right probiotics among the COVID patients, okay, were recovered quickly than the people who do not had right probiotics. When they had a long COVID, okay, people who had right probiotics during the infections had a short COVID. The, than the people who did not have a right probiotic had a long COVID. Reason, you see, this was done in the Harvard University. I did not take the reference of that. So use probiotics in healthy individual aged 18 to 67 years. There were about 470 volunteers have taken probiotics, especially Lactobacillus casei and Pyrobacter longum and Pyrobacter pygidium, okay, with a few essential vitamins and minerals. And controversial, on opposite to this, people did not take any of this as a placebo group, meaning control group. While the control groups were given vitamins and minerals alone, they did not use the probiotics. So when this was studied, they were encountered with the disease, right? The respiratory infections, especially. Okay, the urinary tract infection also, the risk is one. And the people who are recovered quickly, who have taken the probiotics, than the people placebo. Okay, the placebo people had the symptoms and they were likely to prolong for a long period for their recovery. This was an excellent evidence, experimental evidence to show that the probiotics are playing great role in recovering from the diseases. Okay, diseases like urinary tract infection as well as the most of the cold viruses, influenza viruses, were treated and just people recovered quickly than the people who did not take this probiotics. So gut microorganisms are able to regulate the distal, the mucosal side, distal from the intestine through uh, the alimentary canal, and they produce short chain fatty acids that react with our immune system, and the immune systems are on top, and the immune system are on protective mode. So with that, without the probiotics, this short chain fatty acids will not be available, and they cannot have a the upregulated immune response. A healthy microbiota can counteract respiratory tract infection, including influenza virus. So you should understand, even in the same counteraction were recorded with COVID also. And the Streptococci pneumonia, it's a pneumonia causing bacteria, will also be effectively regulated and controlled by the probiotic organism, right? And similarly, nucleotide binding oligomerization domain like receptors were more available with this microbiota than the other individual. So, like Hendrix system, respiratory microbe is complex and which helps in maintaining the good health, including the bacteroidetes and firmicutes and proteobacteria are good bacteria which helps in the maintaining good health even in the COVID infection. Microbiota dysbiosis are found in COVID cases. That is important. The people who died, people who had a long COVID were suffering with dysbiosis. Okay, otherwise they could have been said called that. So the people who suffered through long COVID as well as died had a Klebsiella, lactic acid bacteria, and fecal bacteria, and constantly, and for mosaic viruses are the common things. The intestinal microbiota influence respiratory health and just also protect us from this. Right? So with this basic information, we clearly accept that the probiotics have done a great role in maintaining the health and fight against and recover from the COVID, right? So even if we are not recovered, and there are alternate methods to treat the people with different things. For instance, in this we were um, taking few information that the diabetic individuals were infected with COVID. Okay, it's not recommended to take a few drugs because of the same metabolic pathway and the same receptors they share. For instance, the diabetic people who take few drugs, okay, for instance, this sulfonylurea, okay, as well as the insulin and metformin, will have a common receptor with the COVID virus also. Like for instance, there is a symport of sodium as well as the glucose. Okay, when there is a viral infection. But people who take metformin will have a reverse reaction. So that is going to affect the recovery. So that is how the recommended to use when people infected, sorry, uninfected but living in the COVID environment. Okay, so the people can take this. People having mild COVID symptoms, okay, but still have a diabetes. People who have admitted hospital, right, for the COVID, but they are diabetic. They can take all this, and they are in ICU. Okay, you cannot take metformin, you see, and GLP-I analogs. Okay, so when people take this drugs, it is going to be a severe problem. So likewise, it can be used with caution. These are all the drugs, right? Can be taken with caution. Okay, not recommended. This you are not supposed to use when people are in ICU. I'm not sure when these things are studied and it is given to the doctors who are treating the patient. Right? So with this information, let us come to a better understanding of the COVID infections among diabetic patients. Right? So underlying diabetic mellitus and cardiovascular disease are considered risk factor for the corona patient. The both comorbidity will cause severity as well as worst outcome among the individual who are positive for COVID. Potential pathogenic links are experienced with diabetics as well as COVID in the form of inflammation and deviated hemostasis and deviated immune responses, and also activation of renin angiotensin aldosterone system, right? That causes uh, the impaired immune responses. During COVID pandemic, tight control of glucose level, prevention of diabetes complication might be crucial in the patients suffering with COVID. Right? Evidence that insulin dipeptide and peptidase inhibitors can be used safely in the patients with the diabetic mellitus. But metformin and sodium glucose co-transporter inhibitor might need to be withdrawn in the patients who are in the COVID case, right? That is very important observation. So these two drugs like insulin and TPP4 can be used, metformin and sodium glucose co-transport or inhibitors cannot be given. Pharmacological agents under investigation for the treatment of COVID-19 can affect the glucose metabolism. Okay, there are n number of people claim that that will inhibit the COVID. It is may not be effective, may not be harmless to the normal people, but whereas the diabetic individual infected with COVID should take drugs only with a prescription from the certified doctors. So this is how we have information on COVID and diabetics. Right? So the real culprit is the bacterial metabolites. When we have a good number of people, the orchestra sound will be good. When you don't have right people, the orchestra will be worse. So whether we maintain the best one or worst one decides our health. Right? So with this, I thank you all for your patient listening and thank the authority for having given a chance to just speak to you all on this occasion. Okay, it is almost my privilege and pride to be all with you all, to ignite and just to throw some light on this aspect. We are working on this bacterial metabolites using probiotics. We work on two different areas. One is diabetics, other one is antibiofilm.
Another question.
Yes, sir. You can ask.
Thank you, sir.
Welcome, sir.
Thank you for a valuable session on diabetic comorbidities and COVID disease. Thanks for highlighting the importance of combating the disease with probiotics. This topic is the need of the hour. The session is now open for discussion. Participants can interact directly with the speaker. Alternatively, you may post your queries in the chat box. We would ask the questions for you. Okay. We have collected some questions, sir. So,
Yes, sir. Yes.
what's the first question? Okay.
Hello.
Sir, you
Good
can.
afternoon. Hello. Good afternoon, sir.
Shanmugam, sir, you can ask your question.
Yes, sir. Dr. Murugan, sir. Good afternoon.
Yes, sir. Yes, sir.
I am Dr. Suresh Kumar. I am a professor in the Department of Biotechnology, Nehru College of Arts and Science.
Great, sir. Great, sir.
Sir, you already mentioned the sulfonyl urea and metformin, some synthetic drugs, isn't it, sir?
Yes, sir. Yes, sir.
From these, which one is having high impact value on diabetic patients, sir?
Yeah.
This synthetic drugs we are not supposed to give when the patients are having diabetic. So
Okay.
yes, yes, sir. I hope I answered.
Sir, there's another question. This is asked by a student. So, is there a difference in the effect of COVID-19 in controlled diabetic condition against uncontrolled diabetic condition?
Certainly, it was positive on the recovery of COVID. The people who had uncontrolled diabetes, who had a high level of glucose, has positively favored the COVID viral replication.
Okay.
By that, the recovery period extended. Sometimes loss of life was experienced.
Okay. So this question is quite unrelated, but nowadays we are seeing a lot of small children getting diabetes. We call that juvenile diabetes. Why do you think is the cause?
Yeah, cause you wanted to know. Actually, we also speak on the epigenetics and many other factors, right? So we'll have to analyze where is the mistake, and also the children's should be given probiotics and also their metabolisms to be checked, right? So young ages, the juvenile, the alteration in the metabolism is to be checked, right? And also a lot of epigenetic factors also play a major role. I was,
islets of Langerhans cells get destroyed. Will COVID-19, the virus responsible for the disease, will it have a similar role in creating
certainly. Yes, sir.
it?
Yes, sir. I heard few picture. I did not just include in the slide.
Okay,
It affects the islets of Langerhans, and insulin secretion also drastically reduced when the COVID infection is there, right?
okay,
Basically, wherever we have a ACE2 receptor, it binds and just gives the fibrosis, okay, I mean necrosis of the cells. That is also contributing to the loss of cell, which produce metabolite, especially insulin.
thank you, sir. So that is all we have.
Yes, sir.
Thank you very much, sir. We have now reached the end of today's event. We will meet you all tomorrow at 9 a.m. for day 2 of Ctab. Have a nice day. Thank you.
So thank you one and all for listening this small lecture. Thank you, sir. Thank you.
Thank you, sir.